capacity, you are increasing 4 times, another time is you are increasing 80 times. Agree with me? So madam wants me to stop?
No sir, no sir.
Okay.
Yeah, time.
Okay, so you're getting my point. This is very important. This is what I explained, and this is where you get ROI. And that because I am suffering from past 30 years, my tooth was removed. Even today, I cannot chew 100% on my left side. Why? Because my tooth was extracted, followed with RPD, then followed with bridge, then followed up with implant. So even though I have a screw retained implant, yesterday also I got tightened up and came here. So screw loosening is a very common in my case. Why? My orthopedic, dentofacial orthopedic forces are not getting incorporated with my occlusion properly. Okay? All of you done with this? Okay. Next, prevent bone loss. How much do you think the difference when you give a bridge? What is the difference? It is 1 to 2 millimeter per annum bone loss. You can Google it and see. Whereas with with the implants, it's 0.1 to 0.2, that is 10 times less. So this is your conversion factor to the patient. Agree? So I've given you another 5 points now. Bone loss, or difference with bridge, and the teeth, and the chewing. This is enough for your patient to educate, and definitely my patients come back with these 5 things. So I take at least 15 to 20 minutes, sometimes even half an hour in my first session. Later I tell them, I will not entertain you so much, only on the chair side. So in the chair side again, if you have a 20 minutes job, you do only 10 minutes job, 10 minutes again you educate the patient. And I challenge you, your patient will never go back anywhere else. Because we don't talk, that is the problem. And I was the most silent person in the class, including up to dentistry. And today, I can talk on thousands of people in front. Never as a class leader from my LKG to thing, my teacher always used to ask me, Ijaz, please come down on the stage, read that news and things. We had those people every day, I don't know, still we have that. So, she was requesting me, I said, you want me to give the leadership, I'll give it to you. But I can't go onto the stage. Today I don't feel any fear. You ask me anything, bombard me questions, I can answer you. So that comes only with your way of fear talking to your patients and confident that whatever you're speaking is truth. It's as simple as that. Agree? Okay. Now you can see this, you can show this how the bone loss, if they really want to see, you can show them through pictures, you can show them through videos, or you can just tell them in writing and show them. Okay? Or we have models. Right? You can see the difference after tooth loss and after bone loss. There's going to be huge difference. So what you have to target is, it's not only tooth loss, bone loss. So you have to tell the patient, you're not only losing the tooth, you're losing the bone which cannot be regenerated vertically. We have a next topic is regeneration. If doctor says I can regenerate 10 mm vertical bone, today only I will enroll for his classes. Can we regenerate 1 centimeter bone? Not at all. We can only regenerate in the horizontal, never in the vertical. Hardly mm, 1 millimeter. Agree? All of you sir, those who are madam backside. So we cannot regenerate vertical bone loss. So please remember this. That is another reason to tell the patient that if you lose, your bone is lost, and you show the inferior alveolar nerve as well as the maxillary sinus. Most of it is always the upper maxillary sinus. The resorption is fast because bone is less cortical. And second, it is very close to the sinus. Agree with me? So we come across more problem in placing implants in the 2-6 and 3-6 area, those who start the implantology. I tell them, and I was also guided the same way, do only 3-6 and 4-6 simple cases. Straightforward, simple cases. Like you have a width of say 7 mm, 8 mm bone, you can go with 4.2 mm, 5 mm implants. Then you have at least about 10 mm length, you go with 8.5 mm implant. That should be giving you confidence. Slowly you start doing it, second, third, stay only to the lower implants. Stay only to the lower implants. Then you start thinking about the multiple, like 2 implants, 3 implants, 4 implants and like that. Then you improve, how can I do avoid my nerve. Okay. Then of course the next lecture, that is regenerative part, if you are interested. Today I don't do any I will show you videos and things. So I will talk about regenerative. Today I don't do any regenerative work. If there is nerve, I do nerve bypass. If there is sinus is there, I do sinus bypass. I don't do sinus lifting. I don't do, all these things which I used to do, or probably doctor will show you about the regenerative thing. But I can talk to you on regeneration, whether it is PRP, PRF, stem cell. We had a discussion. I was a speaker and I still speak for Chokran's machine. That is, how many of you know Chokran's machine? Yeah. PRF. Okay. So I was one of the KOL for Chokran in the early 2018-19. I came to Chennai again to speak on that. Okay. So I can talk to you on IPRF, APRF, TPRF, SPRF, LPRF, so many, whatever you want. So, but today is not my topic. Okay. So the concept is you have to understand all these things and go to the simplest way. Implant is not at all difficult, I tell you. Prosthodontist, catch hold of nice prosthodontist, whoever is there. And implants are always prosthetically driven. Please remember this. Don't put implant anywhere and say, okay, I want to put a crown. You should know, when we started, we didn't have MUs, multi-unit abutments. Today we have MUs for it. Later it came even angled abutments. Earlier it was only the straight abutments. So we had a tough time during that time. At least I had a tough time. So later we have, now it becomes so easy and so simple. Whether it is bloodless, whether it is implants, whether it is abutments, everything has become so easy and so simple. So you start with the simplest form, that is the 3, 6 and 4. Okay. I hope I can make those who are not practicing, some ghrelin has gone into your mind. Okay. So ultimately it will improve your oral function, right, and supports your dentures. Now denture could be anything, whether it is removable denture, again it's a big topic. Denture in the sense it could be removable, fixed, hybrid, bridge, that bridge, this bridge, I don't want to talk all that. It's a huge topic, again implant prosthetics. Okay, so anything can be done, depends on what you are planning for, how much is your patient is giving you money, that's your ROI. Alright, so if the patient is ready to pay all 14 and 14, then to fit 3 months clinic close. 14, 28 implants. But nowadays nobody does this. It's all on 6 or all on 4 or all on 8. That's why you have all on XYZ. So whatever, normally I go with 6 or 7 implants, max to max 8 implants. I don't go beyond 8 implants. And lowers I go with 6 implants. I mean, it's my personal. You can do any number of implants. I'm just telling you. I will show you some of the cases also. Alright. Okay. Unlike bridges, I told you, which may need replacing 5 to 10 years, implants can last decades with good care. Now, how do you say that it is only 5? Somebody might say, sir, I am practicing from 25, 30 years. My patient is having since 20 years or 30 years. Why? You have to understand this again. So your patient comes to, this is again an ROI point. So whenever I go, I used to give more lectures on lasers. So they used to ask me, sir, how can I get my ROI out of laser? So that's the same thing I'm telling you. The ROI here is, you have to understand the knowledge. 5 to 10 years is for somebody, not adults. Adult is getting it done say 20s. The bridge can last up to 15 to 20 years. If it is in 30 plus, it can last to 5 years less. Then similarly, your 50 plus, this. Why? Obviously periodontist, you can ask periodontist. So we do have periodontal issues. The bone loss does happen. It's not that what you have in 20s, you have it in 70s and 80s. Definitely there is going to be changes. Agree with me? Whether it is in the form of attrition, abrasion, erosion, whatever it is, there is definitely change or effect in the periodontium. Agree? Like what probably 30 years back you would have used sugarcane to pull, ask the present 20 plus doctors sitting here, can they do it? Can't. So this is what the difference is, right? So the things are changing because of food also. So your bridges has to be replaced. placed. Now imagine somebody who is practicing only bridges comes interesting again an ROI point. How do you convert this? 3-unit bridge. You want to give best. What is the best you want to give? Zirconia, right? So some might charge 7,000, 10,000, 15,000, 20,000, whatever it is. Let's take a very simplest, because I found out on an average anybody even in 2-tier cities it is 7,000. Agree? I charge 15, 12 to 15, but on an average 7,000. Let's take it like that. Okay, 7 into 3, right? 21,000. And imagine the patient is about 40 plus, somebody like me. So how long will it survive bridge? 5 to 10 years. The patient, you don't want the patient to come back after 5-10 years? You want, right? Now what happens? He'll come to you after 10 years or 8 years. Same is denture, prosthodontist. Somebody was prosthodontist, right? So same with denture, sir. 8 to 10 years, you have to change. Either you do relining, change the base, do whatever it is, rebasing, that's all there. That prosthodontist will take care because there is a bone loss. Similarly, bone loss, I showed you how much it is. Agree with me? Agree? Yes. So what is that you are going to tell them? So 21,000 you are already spending it. Okay? Now the patient comes after say 7-8 years. So how are you going to tell them? Either premolar is shaking or molar is shaking or both are shaking. Even if you remove one, again you are going to advise him for 5-unit bridge, provided 7 is there. But 7 is not there. There are people who will take support from 8 also and make 6-unit or 7-unit. If premolar is not there, you will come to canine. Agree with me? And we discussed canine is not into achieving. And last molar, that is your 8 is not into achieving. It is 0%. The moment you put a bridge on that and ask the patient to chew, it hardly will survive for 2 to 3 years. Take it from me, guaranteed. Take it from me. This is my practical private practice I am telling you. It may last for another 2-3 years, but I have not seen person surviving for more than 2 to 3 years. Anybody can contradict me. If they have, I am ready to accept that. So don't you think so this is an ROI? This is an ROI. So you say, you want me to put, I'll put you 5-unit bridge. That becomes 35,000. Or you go with simple 2 implants. Say imagine you are charging implants even 20,000 rupees. With the crown, it is still 40,000. Agree with me? So patient, and you are not touching your canines and the last molar. You getting my ROI there? Young doctors, the host people. Are you getting me? If you don't ask me question, I'm going to ask you question. I'm very bad at question asking. Okay? So that's why I put you again, good morning. We learn something from everyone who passes through our lives. Some lessons are painful, some are painless, but all are priceless. Agree with me? Yes. So it all depends on you if you are taking it positively, because our body is positive. You know all that? The brain has a positive cells. Where do we get negative cells? From earth. When you stamp, I mean we are also stamping, but it's not earth. The simple earth or the grass or the mud, you get negative. That is why in the buildings you say earthing is done. Why? To get the negative charge. So you have to be always positive. God has created us positive. The brain is full of positive cells. You understand? Your glial cells are always positive. But if you are prompting negative, that gets more dominant over it. You understand my point? Now how do I know this? You see this, any videos you see, do we really get negative? And today it is being treated with this technology where they put you copper plate and one end put it into the ground. Your sugar level can be controlled, your thyroid can be controlled. All these are there. Google it and see, I am not telling you. Google it, Acharya, Ayurvedic, he will tell you. Or Biswaroop, BRC, you can see those things. Okay?